My name is Luigi Solbiati. I am currently a professor of radiology at Humanitas University in Rozzano, Milan, in Italy. And I have been working for more than 30 years in the public general hospital in Italy, the Hospital Busto Arsizio. I graduated at Milan University, unfortunately, many years ago. And then I had periods of attendance at the in UK, in England, for the to learn sonography at the beginning of the 80s, and then I had periods of frequency at San Diego University in California and New York, and then I started my work here in Italy. I was invited to give lectures in at least 12 universities in the world in all the different continents. Research and publications, in my opinion, are extremely important in the career of a medical doctor, especially at the beginning of the career, because research and publications give you many different advantages. First of all, you get in contact with people, with researchers, with publications performed in many parts of the world, and this, especially for young doctors, is extremely important. Secondly, if this work is well conducted and well presented, this allows you to be invited to different places, different institutions, different universities, and this again increases your knowledge of different worlds and your knowledge of different medical experiences in different parts of the world. This is something to be taken into consideration when your career develops. In my personal opinion, at the beginning of a career for a young doctor with good interest for the medical activity, the possibility to dedicate most of the time to clinical activity, research and publications is preferable. Of course, when your career goes on and your position inside the department, both a public hospital department or a university department, increases, it's mandatory to learn about how to manage parts of the department, to manage colleagues, to control the activities, and also to manage the budget of the department. This is something which sometimes is not much appreciated by medical doctors, because we feel that our work has to be completely far from the economic implications. Unfortunately, it's not true. Day by day, year by year, this involvement, especially of high-position medical doctors in this kind of economic or management problems becomes more and more important and needed. If you don't take care of that, somebody else will take care, and so your position will be less important. This is a very important question. The incredible, terrific development of technology in the entire medical field is taking lots of the advantages to the new generations. One of them, in my opinion, one of the most important, is exactly the possibility to gain experience, to learn the medical activity using the simulation systems. Simulation systems which unfortunately did not exist when I started my career, my work. Simulation is mandatory, is very important in several medical environments. Not only, for example, for surgical activities, because usually when you talk about simulation, immediately the idea goes to surgical activities. But for example, all the interventional procedures nowadays, when are studied starting from the simulation systems, are much more quickly, rapidly understood and learned by. So all the simulation systems, in my opinion, have the main advantage to shorten the learning curve of the different medical procedures. But simply, if I can add one more concept, simply going back to the simple study of anatomy and pathology, even before performing procedures on patients, is extremely facilitated using simulation systems. The learning curve is much shorter. I have to admit that for years during my activity in the public hospital, I said that the possibility to have multidisciplinary meetings, the so-called boards with other colleagues, would have been very important to increase the experience and to compare the own work with the work of other colleagues in different specialties. And this, honestly, was extremely difficult in my previous place of work. One of the most important advantages of my movement to Humanitas University is exactly this. Humanitas is one of the institutions where, correctly, multidisciplinary teams are particularly developed. Multidisciplinary meetings take place every week in all the different parts, in all the different disciplines. The meetings regarding liver, regarding thyroid, pancreas. And these are extraordinary occasions to discuss cases, and extremely important for young doctors to shorten the learning curve and to listen to different opinions of important doctors in the different fields. Technology nowadays is integrated into almost all the medical activities. So technology and cure of patients are more and more and more related. Every day, every month, we have new developments, new applications, new improvements in technology. And most of them, if not all of them, have a direct implication in our work, in our routine work. Technology can facilitate our work, can expand the possibilities of diagnosing and treating patients. So what I recommend to all the students, to all the young medical doctors, is to be as much related as possible to technologies and new possibilities. Honestly, I am old. My career is just close to the end. But one of the advantages of the young generations is that they were born with technology. So for them, the learning curve to use technology is much shorter. For example, for people like me, it takes time. When my son approaches computers, new technology, he learns in 10 minutes, which is for me 10 hours or 10 days. And so this is something very important for the young people. When a young doctor has to choose which kind of medical activity he likes to take, in my opinion, he has to take into consideration several factors. One of the most important is where medicine is going and what parts of medicine are having the greatest future, the greatest progression on time. Not all the fields of medicine go on with the same speed are with the same progress. Fields like all the disciplines strictly related with technology are advancing very fast. Disciplines like, for example, immunology are increasing day by day because when medical activities related to genetics are dramatically and quickly increasing. So given the starting point of the selection of what I like to do in my career, the second step is where is the best place where I can go to start this kind of activity in the best possible way, again, shortening my learning curve. So the choice of a good place to have the residency is very important, given the fact that, first of all, you have to select what kind of medicine you like to have to do in your life. The suggestion is quite easy, in my opinion. I think that every activity, not every work in any part of the world has to be approached with brain and heart. My father, radiologist, used to say, the day when you will reach your place of work in the early morning, saying, oh my dear, I have one more day of work, that day means that you have to change something in your life. You cannot approach your daily work saying, oh, one more day of work. So the suggestion is whatever medical activity a doctor chooses, to try to approach it in the deepest way, not only studying but also trying to get fond of the work, to be fond of the work. Otherwise, that day mentioned by my father will arrive very early, very soon. So it's important to love the work because our work takes most of our weekly time. So it's important that we love our work.